Once upon a time, in the Gupan city of the Philippines, there used to live a family. On one fine morning, Mrs. Gracio was busy doing household work and her son was playing outside. She suddenly noticed her son is facing difficulties in breathing along with a cough, just like he usually suffers at the night time. And then
Are you okay, my dear? Can you breathe? Are you okay? Oh no, what to do? What to do? Can you breathe? Let's go to the hospital. Come on, let's go. Good morning. Can I see the doctor? My son is facing difficulty in breathing.
Calm down. Doctor is inside busy with another patient. I am the intern here and I will be the one taking history first and later you will get to the meet doctor. What seems to be the issue today and why you came here?
Well, my son have been suffering from difficulty in breathing, Podok, especially at night when he lie down, and he also has cough.
I am sorry to hear that. How long has this been going on?
It's been more than 2 weeks, Podok. At first I thought it's just normal cold, but it didn't improve at all.
Has there been any kind of other symptoms like fever, running nose or some?
There is no fever, Podok, but there is occasionally runny nose.
Had any respiratory illness before or is there any kind of family history of asthma or allergies?
Yes, Podok, his father has asthma, Po.
May I know your status of this?
My kid was completely immunized at the Barangay, Podok.
Okay then, I will apply everything to the doctor. Just wait here. Please come in.
Hello, Miss Gracio. My intern explained me the situation. Please correct me if I'm wrong. So your son has been suffering from cold and cough since past 2 weeks, right?
Yes, Podok.
You've noticed wheezing and difficulty in breathing, especially during nights.
Yes,
Okay.
Podok.
Running nose sometimes. No history of respiratory diseases. But I see your husband is having asthma. I'll be doing the physical examination now. Can you please open this? Inhale, exhale. Inhale, exhale. Can you please turn back? Inhale, exhale. Inhale, exhale. Okay.
After physical examination, I can hear wheezing, which might suggest narrowing of airway.
Based on what you have said, I can consider two possibilities. One is asthma, based on your family history. I can consider asthma, and the other one is allergic rhinitis, which might cause nighttime coughing and post-nasal dripping.
What should we do next, Podok?
I would like to start with a bronchodilator. It will help open the airway. If we confirm asthma, we can also talk about adding a daily inhaled corticosteroid to manage it long term. If the symptom persists, we could also consider allergic testing to see if there is any specific triggers.
That sounds like a good plan. Is there anything else that I should do at home, Po?
Minimizing allergens like dust, pollen, or pet danders in the home could help. You could also try using a humidifier at nights to make breathing a little bit easier.
Thank you very much, Podok. Thank you very much for your advice.
You're welcome, Mrs. Gracio. I'll schedule a follow-up in the next week to see how your child is doing. In the meantime, if the symptoms worsen or there are any serious difficulty in breathing, don't hesitate to come back right away.
I will, Doc. Thanks again.
This is the inhaler doctor has prescribed to your child. Use it twice a day or much more often. Come back a week later so for the follow-up.
Thank you, Budok.
The Universal Healthcare Law is designed to ensure that families can access medical care without being burdened by high cost. For instance, if a child has breathing issues, parents don't have to worry about the expenses. They can bring their child in for treatment without hesitation. So the law aims to make healthcare more accessible and affordable.
So, another important significant part of this law is to mainly focus on the prevention, as the healthcare providers are encouraged to focus mainly on the healthcare issues like asthma and allergies before they become serious. So, if we reduce the symptoms on the early basis, it will be easy for the doctors to treat them early so we can reduce the risk fast.
The law also emphasizes follow-up care. This means that healthcare providers don't just treat a single problem and send patients home, but they monitor the patient's progress over time, especially for conditions like asthma that require consistent management, to make sure that the treatment is effective and can be adjusted if necessary.
This is not only about the medical treatment, this law also help promoting the educating families to self-medicate at their home so that they couldn't approach for the small things to the hospital. For example, the healthcare providers suggest the families to avoid the dust areas around their surroundings and to use the humidifiers to ease in the breathing problems. So this could help the families or the patient to not approach to the hospital and cure themselves in their home.
If symptoms don't improve with these initial steps, the law ensures that families have access to additional care options like allergy tests or specialist consultations without excessive cost. It provides families with the resources they need for comprehensive care.
The universal healthcare law protects the families from having their major medical expenses by giving the medical insurance program so that the families couldn't have any problems regarding the money for their treatment or their specialist care. The main goal of this program is to mainly focus on the healthcare issues other than the money problems.
So, based on the signs and symptoms the patient is facing right now, there are two possible diagnoses. Firstly, we have asthma, which could be causing the narrowing of the airways and resulting in breathing difficulties, especially at night time. Secondly, there is allergic rhinitis, which is one of the main reasons behind nighttime coughing based on the patient's family history and allergic history. So these are the two diseases that the patient is mostly prone to have. So how to approach this patient? Firstly, we will suggest bronchodilator inhaler, which will quickly relieve the patient from breathing difficulties by opening the narrowed airways. We will be monitoring the patient, and so that the patient does not use the inhaler all the time, only when the patient is experiencing wheezing and breathing difficulty. And now we'll be demonstrating how to use a bronchodilator properly.
My asthma. They said they'd fix it, but it didn't make any difference at all.
Well, sometimes doctors make mistakes. Anna, you have to try twice as hard to fix them. Are you using your inhaler?
All the time. Go through one a week.
You sure you're using it right?
Do I look like an idiot?
No. Why don't you show me how your inhaler works?
Using a metered dose inhaler. Take off the inhaler cap and make sure the mouthpiece and spray hole are clean. Shake the inhaler 10 to 15 times. Without the inhaler, take a breath and breathe out all the way. Hold the inhaler upright. Put the inhaler in your mouth above your tongue and between your teeth. Seal your lips around the inhaler. Begin to breathe in slowly. Press down on the inhaler one time and keep breathing in. Hold your breath for 5 to 10 seconds. Open your mouth and breathe out slowly.
So, apart from the inhaler, which the doctor have said earlier, so first we have to tackle the basic things like avoid exposure to pollen. So, how we can avoid of that? So, first thing is reduce the number of pets in your home, which cause the mites in their body to expose to the child, and the pollen, it can increase the symptoms. Another thing, apply mesh or air filter to the windows to all the rooms in the home. It will decrease the chance of pollution from the outside air. And one more thing, avoid smoking exposure. If anyone of the family has smoking habit, like he can aggravate the child to increase the level of asthma severity. And the most thing, when you go outside, or especially during the hot sun or maybe any kind of form, wear a mask or protection, because the CO2 emissions from the vehicles can aggravate the symptoms as well. So in the case of emergency, carry a inhaler along with you all the time, so it can decrease the chance of asthma emissions during the times of need. These are the things first you have to do prioritize before starting any kind of things. First, there are some warning signs. So you may ask, doctor, what are the warning signs should I take care of? First thing is, the most important mistakes people used to make, lack of attention to the baby. If there's lack of attention to the baby, you can't notify the warning sign. First thing is you have to take care of the baby properly. Do attention on the first most thing, because people used to insert objects on their nose or mouth, making it to foreign object insertion, make it too difficult in the time of breathing. And the other things you have to take care of is the signs of blue lips or blue skin or any bluish extremities or legs on them. It means the oxygen is not reaching to the baby tissues properly. And one more thing you should take care of is any kind of things like he's allergic. Suppose if you're allergic to copper, just avoid the things based on copper to him. And one more thing you have to observe, the symptoms is resolving upon taking of inhaler. If no, just rush to the hospital immediately, and we will tackle it based on the symptoms already. And the last thing I have to say is come to clinic after a week or two. So we'll adjust the treatment based on the symptoms which is reducing, or no, we will modify it based on that. Yeah.